Hi, this is Dr. Rudra Mohan, and through the Oral Health channel today we are going to be talking about coronally advanced flap procedure for the treatment of gingival recessions. Let's start. So today I'm going to be talking about gingival recession at large and mostly the procedure for it that is used in isolated gingival recessions. Let me give you a disclaimer: whenever that you have or encounter any sort of gingival recession problem with you, please don't take this video as something that is a definite go-go for your problems, because a gingival recession case requires a lot of meticulous planning, case selection, and the discretion and the decision making ability of a practitioner, especially a periodontist. So what I would like to really tell you is that if you do have a gum problem or recession problem, before making any assumptions about this procedure can be done or grafting procedure can be done, I would strongly recommend that you go to a periodontist and get yourself checked out about the same, and after careful and meticulous planning they can go ahead with your treatment. Now also, one more disclaimer I would like to give you is that a lot of times, and in most of the times, whenever patients complain of gingival recessions, most of the times the bone below the gingival architecture is so resorbed that no matter what kind of grafting surgery we do, soft tissue grafting, it will not suffice, because there is no adequate bone support to support the graft and apply the kind of vasculature or the supply the nutrients and other kind of infrastructural support. Also, I'd like you to be apprised that if the bony architecture below your gums is inadequate, the soft tissue surgery for the gum recession will probably fail, because of the fact that the gingival architecture conforms to the bony architecture. Now coming to coronally advanced flap, I actually made this for a lot of people. Now it is actually directed at the general public, so I'm going to be as careful to be very meticulous about keeping it simple and simplified so that the layman can understand. It's very simple. Coronally advanced flap, it is basically, the corona is actually means, before COVID it actually means the crown. Corona means crown. So basically coronally advanced flap means you have single isolated recessions which can be covered with the help of advancement of the gums coronally with the help of surgical procedures. Now let me tell you something very honestly, the case selection is very specific for coronally advanced flap. It is used in different techniques as well, in conjunction with other materials, even the soft tissue grafts from the palate. But let me tell you, I'm going to tell you the basic procedure as to what happens. After the careful planning and the case selection is done for a single isolated recession, you first prepare the root surface where the recession is seen. And let me apprise you that the recession depth is generally not more than 3 mm, and the width of keratinized tissue, that means the tissue that is resistant to abrasion relatively on the gums, should be 1 mm, and there should not be any soft tissue interdental bone loss for sure in that area, so that we can pull the flap down. Very simple. After doing the root planing of that root surface and making it slightly flatter, you can do a root conditioning or root biomodification, that is up to you. And then what you have to do is, under anesthesia, local anesthesia, from the line angles, that means the side angles of the teeth, we create 2 horizontal incisions which go further than the depth of the recession, and then it turns into 2 vertical divergent recessions that go up into the alveolar mucosa. Let me explain what gingival mucosa or alveolar mucosa is all about and what is mucogingival junction. Alveolar mucosa is basically your lip mucosa, that is this soft tissue, and gingival mucosa is basically your gum mucosa or the skin of the gums. Now the junction of these 2 places is actually the mucogingival line or the mucogingival junction. So once you've given the horizontal incisions, and then if you've continued the vertical divergent incisions, you raise a full thickness flap. Let me explain what a full thickness flap is to you. For example, if this is the bone, this is the underlying bone, and basically these pages are the gums. Now if you see it from this angle, let me explain it properly. If I completely lift the gums, then it becomes a full thickness flap exposing the bone. But if I just lift a part of the gums with a split thickness incision, then there is gum here, the connective tissue bed is here, at the same time there is gums here as well. So this is known as actually as a split thickness flap. So once the vertical incisions have been made and we have to raise that flap full thickness up to the mucogingival junction, and then onwards we have to sever it as a split thickness flap so that it can come down. Also we'll have to remove whatever muscle insertions that might be there, that might be interfering in the advancement of the flap, and the advancement of the flap has to be at least coronal to the recession depth being covered, and then we can start giving the vertical sutures right from the top so that we can stabilize the flap and it can become passive as we go down. The last set of sutures that we give is basically angle sutures around the tooth, and that's where you can dispatch the patient back with any sort of medications, anti-inflammatory medications, and give them post-op instructions such as not to brush in that area, use a cotton pellet to gently swab that area, and then follow all oral hygiene measures for the next 10 to 15 days, and then you do a suture removal. Now the recession coverage has been very promising in such cases, provided the recession selection has been adequate, the case selection has been adequate, and also there has been a modification of this design where what we do is that instead of a full and split design, we do a split full split. The reason behind this is because most of the grafts, as simple as that, if you take a moist seed and you just put it on a pavement, you are not going to get any sort of plant out of it. Let me be very honest. But if you take that same moist seed and you put it in a moist soil that has all the nutrients, and probably you give it some nurturing and everything and watering and nutrition, and then you will see a sapling come out. The same way it works around with grafts as well. I'm pretty sure in the botany side you must have seen that people take those branches of stems and all those things, and then they attach it to another places, and then a new stem or a branch comes out from that place. The same procedure happens here, provided if you have the adequate blood supply, and that's why this modification has happened, so that the blood supply is actually provided with much more abundance after the surgical therapy has happened. So this was today's episode. Please like, share and subscribe, and I'm going to be coming up with newer episodes of gingival recession surgical therapies, because there's a lot of literature. Let me tell you, coronally advanced flap is actually used in conjunction with a lot of other surgical procedures, lot of other biological materials, lot of grafting techniques as well, and a lot of microsurgical techniques as well. So this is going to be a series of various episodes where we're going to be talking about a lot about gingival recessions. But then again, in closing, I would definitely advise you not to take this as for a granted thing. Yeah, I have this kind of a recession, so this surgery will work, and I'll call the dental office and I'll say I want this surgery. No, the dentist will decide along with other dentists and periodontists and other factors that are pertaining to you about what needs to be done. So this was today's episode. Please like, share and subscribe, and do press the bell icon button for important updates. If you need to contact me on WhatsApp, here are my social media handles. Kindly refrain from calling directly, and for whatever suggestions, apprehensions or queries you want to put, please put them in the comment section and I shall reply to them. So that's about today. Thank you.